video, all you need to know about the #1 most powerful and most effective kidney repair food in the world, garlic. Catherine here, I'm a doctor in natural medicine and a researcher in the field of kidney health. A natural approach to kidney health entails basically two things: the renal diet and certain natural remedies. But there is one thing that has so many health benefits that it really blurs the lines between food and remedies: garlic. This superfood is amazing. It helped many patients getting diabetes into remission. It is also one of the most powerful natural remedies for blood pressure you can find, and it also helps by reducing the risk for infections. This is why today I want to show you all the most up-to-date info about garlic. We will see how to prepare it, to get the benefits, what kind of garlic is the best, and more. Just a question before we start: are you using garlic to protect your kidneys already? Why or why not? Let's talk about it in the comment section. Now, the very first thing you may want to ask about garlic is, can you actually use garlic to control diabetes? Garlic is more often used as a way to lower blood pressure, reduce bad cholesterol levels, or to reduce the duration of a cold. But its health benefits are mainly more actually. And yes, recently I've started to also recommend garlic or garlic supplements to people whose main goal is to improve their diabetes status. And the reason is the simple fact that garlic has an incredible effect on fasting blood sugar levels. Patients with diabetes are able to significantly reduce their fasting glucose just by taking garlic. And yes, I've seen these kind of results in person. But you know, when this kind of improvement happens in real life, it's usually achieved with a combination of things, not with one thing alone. So if you want to know how much your fasting blood sugar is going to improve with garlic, we need to check the medical literature. There is actually a review of studies that compared garlic with the most used prescription for diabetes, metformin. And the results are shocking. As we can see here, even with a fairly low dose of garlic extract, patients were able to see improvements in HbA1c comparable to what they will get with metformin. Incredible! But also keep in mind that they were using odorless garlic supplements here, not raw garlic, with doses ranging from 300 mg to 1500 mg a day. I will talk more about the dose later, and we will also see which one is better: raw garlic or supplements. Now, something else worth mentioning about garlic and diabetes is the property of garlic of helping with weight loss that was evidenced by the study. And that was also confirmed by several other studies, by the way. And of course, the way metformin and garlic work is completely different. So a patient could use garlic to work in tandem with metformin as well, since this medication is considered generally safe for the kidneys. And garlic can also be taken to reduce your need for some medications that are, on the other hand, not very safe for the kidneys. So question, what is the effectiveness of garlic in lowering blood pressure? As I was saying, garlic is something I mostly recommend to people with high blood pressure. The reason is simple. The most common prescriptions used to treat high blood pressure, ACE inhibitors and ARBs, are not particularly well tolerated by people with kidney disease. They are also not particularly safe, especially for people in the advanced stages of kidney disease, at the point that trials have been made to decide if it was worth it to keep prescribing ACE inhibitors and ARBs to people with kidney disease. These medications are also the main cause for too high potassium levels in CKD patients, and of course, the side effects are dose dependent, which means that the lower the dose of ACE inhibitors, ARBs, and even diuretics you are taking, the better. Now, this is where garlic can really shine. Garlic is extremely effective against hypertension. If you take it correctly and if you take it regularly, you may be able to completely get rid of at least one of your prescriptions for high blood pressure. And I'm not the one saying that. A recent meta-analysis of 12 trials and 553 hypertensive participants confirmed that garlic can lower systolic and diastolic pressure by an average of 8.3 over 5.5 millimeters of mercury. This is comparable to what you will get from standard antihypertensive medications. So, a completely natural remedy that can reduce your need for diabetes and high blood pressure medications. I mean, where do I sign? But of course, you also need to know exactly how to take garlic to get all the benefits. Now guys, one more question before we see how to do that. So, what is black garlic and is it better than regular garlic? So, this you see here is black garlic. Black garlic is raw garlic that has been fermented under controlled conditions for several weeks. Many people love it because it has a milder, more delicate flavor than raw garlic. It even has benefits of its own, as it is known to contain significantly more antioxidants than raw garlic, which is actually a great benefit for kidney health. So maybe consider trying black garlic and see if you like it. Black garlic is, however, never going to replace regular garlic. The reason is simple. When garlic is fermented and turned into black garlic, it loses a lot of its natural allicin. Now, this is important. You may already know about allicin, the active compound in garlic, but allicin is not present in garlic. It is derived from allicin. What this means is that black garlic is not going to provide you with as much allicin as regular garlic. And even if it has more antioxidants, if your goal is getting kidney health benefits, focus on regular garlic. Now, this brings us to a very important question. How do you use garlic to get all the benefits? Now guys, since garlic doesn't naturally contain allicin, just cooking with it doesn't really give you benefits. It only when fresh garlic is chopped or crushed at least 10 minutes before consumption that allicin is turned into allicin, the active compound that gives you the health benefits of garlic. So what I would recommend here is starting with some garlic cloves, even a half head, and chop or use a food masher to really break these cloves apart. Then wait at least 10 minutes before consuming the garlic. Then take it before breakfast on an empty stomach. This will maximize some of its properties. However, since our goal is to decrease the dependence on medicines, you may also want to take garlic throughout the day. And you can also take it with food if you are having issues because maybe garlic is giving you heartburn. Now, since garlic has powerful antimicrobial properties, you can prepare it like this and store it in the fridge for up to 2 weeks. So you don't have to make it every day, but the taste is going to become stronger the more it sits in my experience. So keep that in mind. Now my question still stands. Are you using garlic? If not, why not? Please let me know in comment section what you think about this. And another very important question you may want to ask at this point is, how much garlic should I take in order to improve? Well, that depends on you. As we have seen, garlic can be used for many goals, improving blood sugar levels, lowering blood pressure, even reducing the amount of medications needed. To achieve these goals, a good starting dose may be 2 to 4 cloves a day. But you want to take that garlic during the day and not all at once. That's because you don't want your blood pressure to fluctuate up and down during the day. Now, you also want to fine-tune this dose based on your needs. So, let's say that you wanted to take less blood pressure medications. How would you achieve that with garlic? First of all, you need to use a personal health journal. This is a simple tool to keep track of all your markers, your blood pressure, glucose levels, your weight, your meals if you want, and more. Writing these levels down is a great way to help protecting your kidneys because you will know if what you're doing is working and you can make informed decision when at your nephrologist's office. Because now your blood pressure is going to be consistently lower and you are not going to need all the blood pressure medications you were previously taking. Yes, that's how you help your kidneys getting better, naturally. Okay, now a very important question. What can you do to reduce the side effects of garlic, especially body odor? For some people, taking garlic in a high enough amount daily to keep hypertension or diabetes under control may cause a couple of unwanted effects. First, there is heartburn. If that happens, consider taking garlic on a full stomach instead of empty. And also consider antacids, especially calcium carbonate based. Now, the main issue with garlic is the body odor. How do you deal with that? Well, first of all, take fresh garlic at the same time as a source of fats such as olive oil. This is actually a very useful tip. Olive oil will increase the bioavailability of allicin, making garlic more powerful, and having more bioavailability will also decrease the unwanted effects of garlic. Something else I recommend is taking garlic with parsley. Parsley doesn't just have benefits of its own, as it is a powerful antioxidant. Parsley is also rich in chlorophyll, a powerful natural deodorizer for the body. Something else you can do is to chew a clove as in the spice, not a clove of garlic, right after taking garlic. Chew it and swish it around your mouth for like 20 seconds, then rinse and use mouthwash. If nothing works, last step will be reducing your dose for garlic. Remember that you can have some of the benefit of garlic even with a lower dose, while also greatly decreasing the side effects. But in that case, I would also consider using some other natural remedies and lifestyle changes in order to keep blood pressure under control. Remedies such as magnesium, CoQ10, hibiscus tea, and more really work. And if you want to know more about that, watch my video up here and also down in the description. Now guys, as I was saying, there is also the option to use aged or even odorless garlic supplements. So the question is, are odorless garlic supplements really odorless? Well, of course, they are meant to greatly reduce the body odor they cause. These supplements are processed to remove or reduce the compounds in garlic that cause body odor. Remember that garlic is a food item, so it contains many more other compounds, not just allicin. And actually, most high-quality odorless garlic supplements are effective at significantly reducing the garlic smell, both on the breath and from the body. However, there is an issue here. Allicin is mostly responsible for the body odor garlic causes. So don't expect a miracle when switching from real garlic to a supplement. Supplements may, however, help keeping your dose more consistent, and they are also more convenient because you don't need any preparation. And when it comes to supplements, you have choices to make. You can either buy from a reputable high-grade brand such as Alicor, Kuai, Kyolic, or try something cheaper from Amazon. If you choose the latter, make sure that the brand adheres to good manufacturing practices and that they state on the label how much garlic extract equivalent the supplement contains. But don't think that just because the supplement is cheap, it doesn't work. And I've actually tested some Amazon supplements on myself and my blood pressure decreased. Now, what you should know about most supplements is that they usually contain between 2 to 5 milligrams of allicin per serving. Garlic cloves yield about 2.5 to 4.5 milligrams of allicin per gram of fresh weight when crushed. One fresh garlic clove weighs 2 to 4 grams. So you will need to take several of these tablets per day to get the same effect of a few cloves of garlic. Now, another question you may want to ask about garlic: can transplant receivers use garlic? I know that some of you guys receive a transplant and maybe some of you also need immune suppression for other reasons. And since garlic in a way boosts the immune function of the body, you may be wondering if you should avoid garlic. Well, my advice here will be to only use garlic with great moderation. You see, some common medications used to avoid organ rejection and to modulate the immune system do interact with garlic. If you are taking this and you also take garlic, the effects and side effects may change, causing you problems. So it's better to focus on other remedies and lifestyle changes instead of garlic if you need immune suppression. And since we are talking about side effects, it's also important to be careful with garlic if you are taking anticoagulant medications, as it may make them more effective. Now guys, garlic works best when paired with a renal diet, of course. So why don't you take a look now at my recent video about the 12 foods you cannot miss in your diet. It's up here and also down in the description, and this is all for today. Thank you for watching. God bless you all. Bye!